Question number 8. A 55-year-old woman presents with pain in both hands and wrists for several years. It is associated with morning stiffness that lasts for almost an hour. Physical examination reveals tenderness and swelling in both hands and wrists, most severe over the proximal interphalangeal joints. Laboratory investigation reveals the presence of anti-cyclic citrullineated peptide (anti-CCP). Which of the following immune-mediated process is responsible for this patient's condition? Okay, so it's talking to you about rheumatoid arthritis, and it's asking you which type of hypersensitivity reaction it is. And it is asking that what is mediated. So this is also type 3 hypersensitivity. You need to know that anti-CCP antibodies, which are IgG antibodies, these are they get deposited here and there, and so immune mediated processes, you need to know that it is a type 3 antibody, type 3 hypersensitivity reaction.
Thanks for watching. Please give a thumbs up and subscribe for more.